you ever been in a situation where you're talking to someone, you have no idea what they're saying, so you say what a few times, still have no idea, so you smile, nod, and hope for the best? Well, that is a daily struggle for a person with hearing loss. I myself am hearing impaired, so I know firsthand the struggles of living in a hearing world. Due to my experiences, I would like to share with you how someone can become deaf early on, types of auxiliary aids, and types of communication. First, let's talk about a person who can become deaf. A person who lives with this disability their whole life was probably born deaf. According to ePain Assist, 95% of babies born deaf have hearing parents, meaning it wasn't genetic. So there are many cases as to why the causes, such as birth injuries, alcohol intake, or drug intakes during pregnancy, low birth weight, things like that. Another way is meningitis. Meningitis is common in babies or children, and it is a fatal illness. 10% of survivors from meningitis end up with permanent hearing loss. There are cases in which it is temporary, but it's less common. They're doing research to figure out if the patients who bounce back from the hearing loss was due to early detection and treatments. Another possible way to develop early deafness is from chronic ear infections. A child who suffers from multiple ear infections are at a risk for hearing loss due to damages of the inner ear. Sometimes inserting tubes can help drain the ears to gain back the hearing. When a child is diagnosed with hearing loss, there are options. First things first, a doctor will fit a hearing aid to the child's ear, and this will help project sounds into the ear for them to hear just normal sounds and words and communication. For children, doctors will fit what is called a behind-the-ear hearing aid. This is due to safety, so because inner ear hearing aids can cause damages if it gets too deep into the ear, and as a child you're growing, so your ears are growing as well. I have my old one from when I was a child that I will show you. So this is what is called a behind-the-ear hearing aid. So what they mean by growing with the child is the ear mold itself. This will change about every 6 months. So you will go into the doctor, they will put this gel into your ear, and it will fit correctly into your ear. And then as it dries up, it turns into this lovely mold. And they also adjust the tubing, so when your ear grows long ways as well, it won't like fall off of your ear. And then here's a place for like your batteries. Batteries are changed like every week, so you have to always keep a set of batteries on hand. Then there's settings for like the volume here, and then here's a setting that will change like background noise and things like that. I will pass this around after my speech is over so you can see it a little closer if you want to. Also, hearing aids last about 5 years, so you have to get new ones quite frequently throughout your life. But for those with complex or total hearing loss, they may benefit from a cochlear implant. This is a surgical procedure, and it is a device that is inserted above the ear on the head, and it creates sounds to the brain. This is also kind of worn like a hearing aid, so you can see it on the outside of the ear as well. And this is so you can change the setting on it and the batteries as well. So does anyone have like a guess as to how much a single hearing aid costs?
$5,000.
5,000? Well, you're not too far off. There is a range. It's anywhere from like $1,000 to $3,000 a piece. So take that times 2 and you have like a small down payment on a house. Unfortunately, insurance does not cover hearing aids. Most of the time they will cover the exams itself, but they won't cover anything else. According to healthyhearing.com, insurance companies view hearing aids as an elective, meaning not necessary. But if you are a person that struggles with a hearing loss, you understand that these are vital to that individual. Quality of life goes down tremendously. This affects the way that you can communicate with just family and friends. It also affects being able to obtain a job and keep it. And denying people of hearing aids isolates them from the hearing world. Most of the time, hearing devices are not enough for the deaf. Even babies who are born deaf and diagnosed at an early age need to take big steps to keep up with communication. So this is important for families who figure out that their child is deaf to discover what kind of language they want to use in the house. And this must be a primary language. So if you want to have your child speaking and reading lips and things, you must do that only. If you want your child to only communicate ASL, which is American Sign Language, everybody in the household needs to do that. There's a small window, like I think it's like 6 months to 3 years for a child to learn how to speak and read lips and things like that to keep up with everyone else. So it is important that the child learns how to speak and read lips and master that before you teach them ASL on top of that. So it's not saying that you can't do both, but they really need to master the spoken language first before adding ASL onto it as well. If the child knows how to do both, this is actually called bimodal. More than 80% of hearing impaired children are successful in public schools. You tend to be more successful if you can speak a spoken language and read lips, just due to being able to keep up in class and communicate with other children and teachers and things like that. Not saying that children who are exclusive in ASL aren't successful, it's just that they need an interpreter, and it makes it kind of harder for them to make friends and communicate with others. So the best thing anyone can do when speaking to the deaf is enunciating your words and let them see your mouth. The deaf usually don't see this as a disability, and they really want to be treated like anyone else. So now that you know how a person can become deaf at an early age, hearing devices that they use, and different communication forms, you'll now understand their struggles and how to quickly adapt to their needs.